People want to be heard. Addicts and alcoholics just want to be heard, or anyone who struggles with a mental illness too as well just wants to be heard.
It is a tough topic for a lot of people. Tonight, a special focused on mental health. We'll hear from those working closely to help people of all ages get the care they need.
We need more mental health professionals.
Plus, how the COVID-19 pandemic has changed how we approach the topic of mental health. Good evening, everyone. Thank you for watching 10 News at 5. I'm Robin Wilhoit. Today, we are shining a light on mental health. First, what is mental health? According to the Centers for Disease Control, it is a state of well-being that enables us to cope with the stresses of life, realize our abilities, learn and work well, and contribute to our community. The Knox County Health Department says more than 50% of Americans will be diagnosed with a form of mental illness at some point in their lives. More than half of those, around 28 million people, will not receive care. As to why, experts with the Mental Health Association of East Tennessee say there is no single cause for mental illness.
Mental health onsets all across the lifespan. 50% of all people who need mental health care will have their very first symptoms start by age 14.
According to the Knox County Health Department's 2023 mental health report, Tennessee ranks 46th in the nation for mental health workforce availability. That's how many providers are available for mental health care. For every mental health provider in Tennessee, there are 590 people. That is compared to 350 people for every one provider across the U.S.
We're working on that diligently to try to make sure that we have more care providers to be able to sustain and continue the kind of care and wellness that our employers and our employees deserve in the marketplace, as well as just the general public.
And with many mental health conditions come myths. One common misconception is that people who suffer from these illnesses are dangerous. But according to the Mental Health Association of East Tennessee, most violent crimes are not committed by people with a mental illness. Experts say the stigma surrounding mental health has changed in recent years, and now more people are willing to talk about the challenges they face.
The perception of people being intolerable to be around is just not true. Most people with a mental health issue are not violent, scary, or dangerous, and actually live and work in our communities. Very few folks ever are institutionalized anymore.
Despite becoming less stigmatized for many people, seeking mental health services can still be difficult for so many because of the price tag. Even a quick therapy appointment can be expensive. 10 News anchor Shay Smith joins us. And Shay, you looked into the cost of mental health services right here in East Tennessee.
That's right, Robin. Seeking mental health services isn't always as easy as going to your primary care doctor or just stopping by an urgent care. It can be difficult to find a therapist accepting new patients. There could be long wait lists, and it can also be pretty pricey, even with insurance. And not all insurance even cover mental health services. And some therapists don't accept insurance, so you have to pay out of pocket. But there are some options for those who may not be able to afford mental health services.
Those folks that are in Medicaid, they would have access through providers like McNabb Center, Cherokee, Ridgeview and Oak Ridge, Peninsula Behavioral Health. If folks are in what's called the Behavioral Health Safety Net, that is also for folks that are just a little bit above Medicaid eligibility, but below 138% of federal poverty level. They would have access through those same providers, but for a lesser array of services. Those that are above 138% of federal poverty level may be in this real gap, if you will, of folks that need mental health care but can't afford it. So what's going to happen? They usually will delay and end up in crisis services.
Ben Harrington says those who are above 138% federal poverty level can still be in the gap of people who need mental health care but still can't afford it. He says the Mental Health Association does have a program that can serve those people.
We will match that individual up with a therapist that we will help pay for. And then that person could receive as many as 15 therapy sessions that we're going to help them have access to.
Now, he says those sessions are a good start, but mental health struggles don't just disappear after a few sessions. So he says their goal is for those who used their 15 sessions will be in better shape and able to manage what they are dealing with a bit better.
All right. Shay, thank you very much. The Mental Health Association of East Tennessee does offer some resources. You can find their information on this story on our website. Or for many people in our area, current events are a stressor that can cause mental distress. It's been nearly a month since Helene ripped through the southeast, destroying homes and towns and lives in its path. The families impacted by the storm now face weeks of rebuilding what they have lost. For some people, that's everything. Experts say the effect natural disasters have on mental health often starts small, but can quickly turn into chronic long-term problems.
Our friends and family members in Northeast Tennessee, they're experiencing that right now because so many have been displaced because homes and the little villages along the riverside got destroyed. And so that's going to be stressful as they try to rebuild.
For a list of ways you can help storm victims, text the word HELP to the number on your screen for a link to that list, or you can go to our website. To learn how to apply for help, scan the QR code on your screen. It will take you to an article on our website where you can find helpful links to federal and state resources. And we have a full list of mental health resources available right here in East Tennessee. Text the word HEALTH to 865-637-1010, and it will direct you to that rundown of resources that can help. Again, that number, 865-637-1010. Still to come, substance abuse often leads to mental health disorders. Ahead, a family close to us right here at Channel 10 is helping people work toward recovery. And then the coronavirus pandemic changed all of our lives in some way. Coming up at 5:45, how the pandemic affected America's mental health. Substance use disorders and mental health disorders often go hand in hand. People who struggle with their mental health can turn to substances as a form of self-medication, and people battling addiction can experience negative effects on their mental health. Well, this is something 10 News anchor Sam Perez's family sees often through their work through DV8 Kitchen. Sam's parents opened DV8 Kitchen in Lexington, Kentucky. It hires people in recovery from substance use disorders. Sam wrote a book about what she has seen through her family's work, and we sat down with her to learn more about how addiction and substance abuse are intertwined.
I think that a big part of that is because of isolation. So having community when you're in recovery is so important, and that's something that the restaurant provides. There is this safe community at work, outside of work, at DV8.
When it comes to the restaurant's impact, Sam says every single year, DV8 hires more than 40 people, generating a yearly total of $2.4 million for the local community and saving more than $1.5 million in addiction expenses. Coming up in Knox County, we're seeing drug overdoses decrease. Coming up, we hear from a man who went from spending time behind bars to helping others fight the same battles he did. COVID-19 affected all of us in some way, whether you had to work from home, had children in distant learning, or weren't able to go to work and get groceries at the store. You were probably impacted. Americans still face a mental health toll years after the pandemic. Research shows post-pandemic, more Americans struggle with mental health issues. 10 News anchor Shay Smith explains the research.
Experts agree the pandemic had a huge impact on people's mental health, starting with anxiety.
Early in the pandemic, you had folks struggling with, oh my gosh, what's my employer going to do? Why aren't they making a decision? That was anxiety producing for employees.
Plus, isolation and depression. Ben Harrington with the Mental Health Association of East Tennessee says before the pandemic, about 1 in 5 people needed mental health care. After the pandemic, it rose to 2 in 5.
The prevalence of adults with anxiety disorder surged to 37% of adults having anxiety problems. The number of adults with depression surged to 41%.
He also says the actual virus induced mental health disorders in people who may not have struggled before their diagnosis.
A third of people that developed COVID who did not have a mental health condition previously, a third would develop a mental health condition within 90 to 180 days of their COVID diagnosis.
And with that, research also shows people who already struggled with their mental health struggled differently after contracting COVID-19.
COVID's influence on the pre-existing mental health condition tossed everything we knew about that person's illness out the window because it made the treatment regimen for that individual no longer work.
But Harrington says the pandemic did bring mental health issues for Americans to the forefront.
One of the blessings of COVID pandemic is the mental health conversation became one we can have, acceptable.
That expert says as more people seek mental health services, there's a new question. Are there enough providers to meet that influx? Nearly 90% of people in Knox County say there are not enough available appointments. One of the biggest issues for those seeking mental health care is finding that care quickly. Leaders say the lack of professionals is not just a local issue.
Knoxville needs to do better. And do better, in my mind, means we need leadership to say, let's not just be like every community across the country that says, we can't find professionals. You can, and with the right resources.
Harrington says adding a talent recruitment fund would help add more licensed professionals. The Chamber of Commerce says it's been working closely with the University of Tennessee to prevent students from moving away after graduation.
Unfortunately, we see a lot of our young folks graduate from the University of Tennessee and then feel like they need to go to Paradise. Paradise being Atlanta or Nashville or Charlotte or one of the bigger areas.
Home Sweet Career and Home Sweet Home are just a few programs the Chamber works with at the University of Tennessee. Mental health illnesses like depression can be common for people who are also battling chronic illnesses like heart disease, cancer, and more. Undiagnosed mental illnesses will worsen over time if they go untreated. They can also impact the treatment of other conditions, for example, heart disease. According to experts, it doesn't matter which illness came first. Not treating depression could impact the overall care people receive.
And if we don't identify the depressive symptoms and treat the depression, then what's going to happen is that person's heart disease may not respond to the usual treatments for heart disease.
Harrington says if someone has a medical condition and is not responding to care, they should think about having a mental health screening. In Knox County, drug overdoses are slowly decreasing. In 2023, 519 people died from an overdose. And in 2022, that number was 544. That is a 5% decrease in just 1 year. 10 News reporter Olivia Daig spoke to a man who was incarcerated in Knox County and now serves as an addiction counselor. He says resources are becoming more available for people.
I started out when I was 14 years old, experimenting with marijuana and alcohol, and it escalated over the years. I began using crack cocaine, and at the end of my journey of drugs and alcohol, I began using heroin.
Rico Hopewell is thankful he's been able to change his life.
I've been in jails, institutions, and almost death.
He sat in a Knox County prison cell and prayed to God he would lose the desire to abuse drugs.
I'm a man in long-term recovery, and I have 17 years sobriety. It wasn't an easy journey.
Hopewell runs a sober living community,
I just love to help people
the Mend House.
because they believe that I don't understand, but I do on a deeper level.
He says his own experience has made him a stronger person and counselor.
Addicts and alcoholics just want to be heard, or anyone who struggles with a mental illness.
Hopewell says the perception of addiction has evolved.
Addiction does not discriminate. When it began to be exposed within affluent individuals, something had to be done. And so now I just believe that there's more being done because of the individuals who are becoming addicted.
He also says assessments for young people could be a step towards prevention.
We have to get the information that we need in order to help people and also to prevent at an early age.
His message is that there's hope for everyone, and asking for help is okay. In Knoxville, I'm Olivia Daig.
Hopewell's sober living community, the Mend House, can house up to 40 people who want to commit to a community of support to help them through their journey to sobriety. We have more information on our website right now at WBIR.com. Again, that counselor tells us his mental health journey began behind bars. A report from the National Alliance on Mental Illness says 40% of people in jails across the U.S. have a history of mental illness. Fewer than half of those receive the care to treat them. Enrico Hopewell tells us the prison system has improved with regards to mental health, but there's still work to do.
The rates, the percentages of individuals who are incarcerated have a high percentage of a substance use disorder or a mental illness. And so that needs to be really addressed. And so that's how we decrease the recidivism rate.
The Knox County Jail recently added a mental health court as an incarceration alternative. Hopewell says these programs will help prevent repeat offenders.
I think they are doing a better job with mental health assessments, also having advocacy within the prisons, also drug programs.
It is never too early to learn about mental health. Coming up, the local group teaching students how to make it a priority from a young age. Students across East Tennessee are learning about mental health through the Mental Health Association of East Tennessee. 10 News reporter Olivia Daig sat in on a Mental Health 101 class to understand what children are learning at an Anderson County school. Olivia, what topics are they tackling?
These topics range, Robin, from identifying your emotions like sadness, anger, and loneliness to talking about eating disorders and suicide prevention. There's a group of about a dozen people working in this Mental Health 101 program. They are aiming to help students recognize mental health struggles and know where to find help across Tennessee.
As these middle school students walk into the gym at Norris Middle School,
So welcome back to Mental Health 101. We covered part 1.
Jennifer Kitts hopes they'll take one thing with them out of their 40-minute session with her.
It's okay to talk about it so you can understand what you're going through and how to manage it.
This class at Norris Middle is just one example of the Mental Health Association of East Tennessee trying to help what they call a mental health epidemic.
Do you feel like sadness is a healthy or an unhealthy emotion? Unhealthy emotion. What do you think? Healthy emotion.
Kitts is one of many mental health educators who will speak at over 120 schools and reach 30,000 students.
Here's ideas for healthy coping and a checklist for daily care because it's cool to care about yourself.
Over these sessions, the students explored several topics.
This content is heavier.
Kitts says the heavier topics like suicide and self-harm are discussed among older students, but she says watching them listen intently and ask questions is a sign they're understanding the material.
Oh, I'm not the only person that's struggling with my thoughts, feelings, or behaviors. We all experience this.
And classes like this one are one piece to tackle the mental health puzzle in schools.
Robin, this class was so comprehensive. It was so amazing. I wish I had something like it at school.
Me too, for sure. Now, Olivia, one of the things you asked Jessica is, what's changed? How do they view mental health differently these days?
She says really what she's noticed is that there's less stigma. There's less weight about the conversation, that it's a topic that's more discussed. And so it's really just helping these kids understand this topic and be okay with talking about it, knowing it's okay to say I'm not okay.
Yes, we have to keep those lines of communication open. Olivia, thank you. And thank you for watching 10 News at 5, our mental health special. 10 News at 6 is next.